Good evening, everybody. I want to thank you guys for joining us here on the Aesthetic Management Partners webinar on platelet-rich plasma, Cellenis brand platelet-rich plasma, and XOE. I'm going to give everybody a few minutes to get started here. It looks like we got about maybe half the participants on, and I'll give it just another couple minutes and we'll get going. We'll wait just one more minute and we'll get things started. All right, I want to thank everybody for joining us this evening. We are among some giants in the industry today as our guest speakers. I want to thank Dr. Ketterpaul and Mr. Larry Hellwig for joining us today. They're going to be our speakers on PRP and the XOE products. Our first speaker, we're first going to cover the PRP version of the talk, and then we'll move on to exosomes, and then we will have a portion for Q&A. And I am going to have a portion at the end to where we kind of do have a call to action for you guys. If you're wanting more information, there will be a link for you guys to fill out a form to get more information. If you want to be contacted by one of the local reps or need some more direct information from myself or one of the other speakers, then we'll be able to get that to you guys here at the end of the video as well. But our first speaker is Dr. Shilpa Ketterpaul. She joins us from Cleveland Clinic. She's an ASDS fellowship trained and board certified dermatologist. She's also associate professor of dermatology and the director of laser and cosmetic dermatology at Cleveland Clinic. She did do her dermatology residency at the Cleveland Clinic, and she did an ASDS cosmetic fellowship at Skincare Physicians in Chestnut Hill, Massachusetts. She has been performing PRP for hair and skin rejuvenation since 2016, and has performed over 2,000 procedures. Dr. Ketterpaul has presented at both local and national professional meetings on PRP with microneedling, and has authored numerous chapters in books, dermatology textbooks, and published numerous articles in peer-reviewed journals. In the fall of 2021, she also published a book on PRP called The Aesthetic Clinician's Guide to Platelet-rich Plasma. She is no less an expert in this field, and I will turn things over to you, Dr. Ketterpaul.
Great. Good evening, everyone. Thank you, Dr. King, for that wonderful introduction. Thank you all for joining us. I'm really excited to share my experience on PRP with all of you, and kind of just discuss how the evolution of it, some of the science and literature behind it. I will say, most of my experience with this product was with the Eclipse brand, which is now Cellenis PRP, and then we will save some time for a Q&A at the end. So with that, we'll go ahead and get started. So just a little plug for my book. This is published with Springer in the fall. It really goes over the literature, all the different indications for platelet-rich plasma, not only for hair aesthetic, for hair restoration, but also for the skin. We discuss things like scarring alopecia, the future of stem cells, and all of that. So With that, let's just talk a little bit about hair loss in the US. Some of you might be familiar with these statistics, but it's super common, as I'm sure you all see in your practice, estimated to be around 50 million men, 30 million women. It starts early as puberty, especially in males. And as time goes on, so does the risk. So the statistics are 50% of men by age 50, 50% of them will have hair loss, and then 60% by age 60, so on and so forth. Numerous factors play a role here. Genetics are the biggest. We know androgens like dihydrotestosterone, also nutritional and inflammatory things. Right now, there are only 2 FDA-approved treatments for androgenetic alopecia. So finasteride 1 milligram in men, which is known as Propecia, and then topically 2 and 5% minoxidil. It requires compliance over a long period of time for effectiveness. It does have limited efficacy, and with minoxidil, you can get some irritation, and then with finasteride, sexual dysfunction. What's also been reported is this post-finasteride syndrome. Even when men stop it, they can still have some issues. So a Cochrane review done several years ago showed that despite using finasteride and minoxidil, 40% of men still go bald. The efficacy can be unsatisfactory. It has a significant psychosocial impact, and improvement is not always seen. So that's when several years ago I said, what else can we do to, to get improvement? And that's really where PRP came into the picture. So it had been used before in like the joints, in wound healing, and we've really expanded its use in hair restoration. So just an overview of what is PRP, or platelet-rich plasma. When you look in the blood, in whole blood, about half the component is plasma, and then about 40 to 45% are red blood cells, and then a small portion are your platelets and your white blood cells. So it's essentially a high concentration of platelets in a small volume of plasma. It's defined by 1 million platelets per ml, or between 2 and 4 to 7 times the concentration of whole blood. The reason we use it is because it contains a lot of growth factors, fibrin, fibronectin, vitronectin. What this does is activate our fibroblasts, synthesize our collagen, and then essentially synthesize VEGF, or all of our vascular growth factors. Just a little flashback to basic science. Our platelets have alpha granules in them, both alpha and dense granules. Alpha granules are the ones that have all the protein growth factors. Now, these are listed here. They each play a unique role in the hair cycle, but essentially they stimulate cell growth, new blood vessels, and new collagen. And then we know specifically insulin-like growth factor actually prolongs the anagen, which is a growth hair, the growth phase of hair. So not only are we seeing improvement in the vascularity and the diameter of the hair, but also inducing new hair. The dense granules are not as important when it comes to hair, but they can increase the membrane permeability that allow all the growth factors from the alpha granules to penetrate a little bit deeper and to be activated. So these are just some of the key growth factors that we see in PRP. They're listed here, predominantly platelet-derived growth factor, VEGF, and then insulin-like growth factor. So all of these play a role to stimulate hair growth and to normalize cell turnover. So essentially you have these growth factors, they go on in the tissue to help proliferate, they migrate, differentiate, and then angiogenesis. It's important to know that not all PRP types are the same. There's different ways to categorize them. This in particular looked at the leukocyte and fibrin content. So most studies in the literature are based on pure PRP. There's also leukocyte-rich plasma and PRP. This is used mostly in the orthopedic realm for joints. There's pure platelet-rich fibrin, which has a role in wound healing, and then leukocyte and platelet-rich fibrin. It's important to know that leukocytes, or white blood cells, are considered a contaminant. They cause tissue inflammation and damage. For those of you who are dermatologists or dermatopathologists, when you look under the microscope at a hair sample of AGA, there's prominent fibrosis and a neutrophil-rich inflammatory infiltrate. So we want to minimize the inflammatory cells we're delivering to the scalp, because any kind of white blood cell can make hair loss worse. So we're really after our PPRP, or our pure PRP. We want the highest number of platelets and the lowest amount of leukocytes. So PRP is really an umbrella term. They are not all the same. It does not allow for a distinction between the available products. When someone says PRP, it does not take into account the platelet concentration or the presence of leukocytes. So not all concentrations are equal. There's about 20 different PRP separation systems on the market, and there's really no standardization in dosing. So the lack of standardizing methods for preparation makes it difficult to correlate between studies. So when you read a clinical study, it's really important to know what was the concentration of PRP compared to whole blood, Was there an inflammatory infiltrate? Was it, single spin, double spin? All of these play a role, and that will determine ultimately your final result. Another classification called the DEPA classification looked at these biological differences, and they found there's a large variability in clinical benefit, especially in the hair. So D stands for the dose of injected platelets. In order to know the dose, you need to know the concentration of whole blood. E is the efficiency of production. So after you spin the blood down, what % of the platelets are recovered or retained? P is the purity, so the presence or absence of leukocytes. So more pure concentrates will have less leukocytes. And then A is activation. Do these contain thrombin, calcium chloride, or nothing at all? In some of our literature, we've actually found in our research that just the trauma of passing the platelet through the needle is enough to activate it to release these growth factors. So, PRP is a very straightforward process. For those of you that have been using it, especially with the single spin system, it's just a peripheral venipuncture. You centrifuge the blood for 10 minutes, you remove the platelet-rich plasma, and then you collect and resuspend the platelet-rich plasma. So looking at the tubes, this is a picture of the 22 ml tube. It's important to know where your platelets are. So you can see you have your gel, and then underneath the gel are your red blood cells. Right above the gel, that dense area, those are your platelets. That is your platelet-rich plasma. And then above that is your platelet-poor plasma. So platelet-poor plasma, we don't typically use. It's only 1 to 2 times the concentration of whole blood, not enough growth factors to really make a clinical difference in the skin or hair. But the platelet-rich plasma is what's right above the gel, and that is your concentrated amount of platelets suspended in plasma. So important to know the different types of FDA cleared class 2 PRP systems. They can be thought of simply as your small volume single spin systems and then your large volume double spin systems. This by no means is comprehensive. There's obviously numerous systems on the market. But your small volume single spin systems, anywhere from 8 to 22 mLs of blood, these are meant to have the gels actually pull out your red and white blood cells. So they're very low in inflammatory infiltrate, but they have, medium platelet concentration. So around 4 times the concentration, 2 to 4, depending on your system. This is in contrast to your large volume double spin systems. These are designed for your orthopedic uses. These are going to take more blood. You have higher platelet counts, but you also have higher inflammatory cells like your white and red blood cells. So you have more of the good stuff, but you also have more of the bad stuff. And, what does that mean clinically? So looking at, some different studies where they looked at actual platelet concentration, it's not always directly related to the amount of blood you take. So, the large tube separator systems, looking at the Cellenis and the Helion, even though the Helion had more mLs, the platelet concentration was still lower. And then the smaller tube separator cells, obviously, when you have less blood, you're going to have less platelets. And then, the double spin systems will have higher amounts, but they're also going to have a lot of inflammatory cells. So important to understand that difference. So looking at the difference in your final product, you can see on the left here, your double spin system, see how it's very red, it's very dark. Those are all your inflammatory cells. It's full of white and red blood cells. So yes, you have more platelets, but you also have more of those inflammatory cells. And we know in the skin and hair that can lead to detrimental things, more hair loss and inflammation of the skin. If you look at the gel separator systems on the right, you can see that, that yellow cloudy product. It's yellow because you've removed all of the, majority of the white and red blood cells. So it's also a difference in the final product. I will say because of the red and white blood cells in the double spin systems, it's also very acidic. Patients will complain of a lot of pain. So people that have had double spin PRP injected into their scalp, almost all of them will report having a ring block. If they don't have a ring block, they can also have significant amount of discomfort. There's also some controversy. How does lidocaine affect the PRP you're injecting? So for all of those reasons, that's typically why in my practice, I stay away from the double spin systems. So looking at the concentration of platelets, this is an important concept that, you can look at the total amount of PRP you get, and people ask, well, why do you draw off the platelet-rich plasma? The reason is when you draw that off, you're left with a more concentrated final amount. So, here, the total number of platelets is the same, but the concentration is different. So with a higher concentration, you can deliver the same number of platelets in a fewer small volume of injection. So that is why we discard and remove the platelet-poor plasma. So once again, looking at the 22 ml tube, where are the platelets? And they're actually, majority of these platelets, 97%, are in the bottom 7 cc's of the plasma. So they're resting right on top of the gel. That's why when you remove your platelet poor plasma, it's important to shake or agitate your platelet-rich plasma to get all those platelets that could be stuck to the gel. So this is a really nice diagram just showing where the platelets are. Looking at, single spin versus double spin, a study done in Colorado State University looked at a single spin system versus a double spin system. They found the single spin system eliminated granulocytes, double spin had higher concentration, but also higher granulocytes. And ultimately, they found that the single spin was ideal for hair. So I'll just go over some of the prominent literature. Obviously, just in the interest of time, we won't cover everything, but just the high points about, the differences in the different single spin, double spin systems. So what role do white blood cells play in hair loss? We know inflammatory neutrophils are present in higher levels in patients with androgenetic alopecia. They, we know that you want to deliver a low white blood cell concentrate and low TGF beta 1 because TGF beta 1 actually stimulates apoptosis, which is going to cause the hair to go into telogen and then ultimately shed. So we know the orthopedic kits or the double spin systems have 4 to 7 times increase in white blood cells, and these separator gels eliminate most of the white blood cells. People say, okay, well, why not make homemade PRP? Why do I need to spend money on these kits that are expensive? Why can't I just use, a tiger top tube or a lab tube? So it's important to know that these are made for labs. They cannot be used as a medical device, and they are not FDA cleared for reapplication to point of care. There's also no way of knowing your platelet count or concentration, and most of your platelets are going to be lost when you centrifuge them because there's no gel. You end up with platelet poor plasma. Also, they can contain harmful ingredients like pyrogens and glycol, and they're not meant to be re-injected into a patient. Some of them even have a warning on them. It says, do not use tubes. Sorry about that. Do not use tubes for collection of materials to be injected into patients. You can get backflow, and basically the blood and blood components processed in the tube are not intended for infusion or introduction into the human body. So for many reasons, lack of efficacy and safety issues, we don't want to try doing this on our own. Just some studies that looked at PRP and AGA under the microscope. I think this is a really important study when we were kind of first coming out with PRP for hair. This is back in 2017. So, before PRP in the scalp, looking at a biopsy, there was inflammatory infiltrate. After PRP, it was decreased. The anagen phase was increased by this fibroblast growth factor 7. That thin atrophic epidermis was replaced with a thicker epidermis and increased Reedy ridge number. Apoptosis was decreased by a decrease in BCL2. The vascular plexus around the follicles was improved. There was less perifollicular fibrosis, more organized collagen, and then more elastic fibers. And ultimately, all of this led to an increased terminal to vellus hair ratio. So all these changes basically stimulate, hair growth and reverse some of the signs and changes we see with AGA. This mechanism of action was published in Derm Surgery in 2016. Ultimately, they said that PRP stimulates hair growth through the creation of new blood vessels and encourages hair follicles to enter and extend the duration of the anagen phase of the growth cycle. Anagen is the growth phase. And this is through, the Wnt pathway, which many of you might be familiar with, and then other signaling pathways, which leads to necessary cellular and proliferation and differentiation. So, each year there's more and more literature coming out supporting PRP's use in the hair and in the skin. This was a study done with the now Cellenis PRP. This was previously the Eclipse PRP, 22 ml tubes. And I think this is really interesting looking at protocol. So they had two groups. One group received monthly PRP injections. The other group received quarterly PRP injections. The monthly group had a 29.6% increase in hair density, and then a 31% increase in hair shaft thickness. The group that got quarterly injections only had a 7% increase in density, but similar improvement in thickness. What that tells us is when you are, planning these treatments, it's really important to see your patients back monthly, like 4 to 5 weeks, to increase the density. The thickness increase is going to be the same, but to get that, increase in hair density, 3 monthly sessions was needed. They also did the subdermal injection technique. So not intradermal, this was subdermal or sub-Q. It had minimal pain. They did not need anesthesia, and the average pain was 2 out of 10. This allowed for fewer total injections, and then it spread via diffusion. So this is the technique and the protocol I follow in my practice. We don't do any ring blocks. We just use ice and a chiller, and patients are very comfortable. This was presented at ASDS in 2019. This is also with the now Cellenis PRP kit, formerly Eclipse. They basically looked at women with AGA, and they found that PRP improved hair density, caliber, and other factors. And these were patients who were not using anything else. So, just in summary, this was a paper Dr. Wilma Bergfeld and I wrote. This is several years ago. We found for best protocol or best practices for PRP, using a system that's 3 to 6 times the platelet concentration of whole blood, a single spin to get minimal granulocytes, a subdermal depot injection, endogenous activation, meaning the trauma of the platelet going through the needle enough to stimulate activation, 3 monthly treatments followed by a treatment 6 months later, so 4 in the year, and then yearly maintenance. And then we've done some patient-reported outcomes with the hair dex scale, increased quality of life, and then patients also found more regrowth density and just overall positive results. So with that, just in the interest of time, I'll just quickly go through this. It's important at the consultation to know some history from them. What have they tried? How long has the hair loss been going on? Other medications? We know we can use PRP for many different things. I wanted to share quickly before we finish just some clinical photos. We have a professional photographer. I think photos are key to follow their results. We are also able to do trichoscopic images, which we do now for all of our patients, and we can measure the telogen to vellus ratio, anagen hairs, and measure the diameter of each hair. So this was a patient, this is before and after 5 treatments. Now I do medically treat my patients also. So most of these patients were stable on a medical regimen for several months or years before we added PRP. And then this is after. So we standardize our pictures. We take 6 views at every visit. During the 10-minute spin, it's a great opportunity for our photographer to grab the patients and take photos. With women, you have to be cautioned that, if they color their hair, it's going to change the outcome, but we are able to validate what we're seeing globally with trichoscopic imaging. So this is before and after 4 sessions. This was a gentleman with AGA. He actually did not want to do anything else. He had been using topical minoxidil for some time. This is before and after 4 sessions. And then looking from the back. Interestingly, this patient was in his 60s and he thought he was kind of too far gone. We just did PRP as monotherapy. This is after 2 treatments, and a lot of the regrowth he had was dark. So we do know that some of these growth factors actually stimulate the melanocytes in the bulge region or the stem cell area. And a lot of patients who are gray will get regrowth of their initial hair color. And you can see a lot of the hairs were darker, even existing hairs there. This is looking at alopecia totalis. So, we do a lot of research with autoimmune alopecias, areata, totalis, universalis. This patient did color her hair in between, and she was someone I treated years ago, but she did have accelerated regrowth with several PRP sessions. And this, I think, is really, really impressive what she was and what she is now. She's actually one of the patients that was in our tofacitinib study after this, but she had a really good result to PRP. So with that, I do believe we're going to do some questions at the end. So I thank you all very much for your attention, and I'm really excited to share everything I know and have about PRP. So with that, I'm going to turn it back over to Dr. King. Thank you.
Thank you, Dr. Catterpall. I appreciate your input and hanging around for the questions as well. That was very informative. If you didn't join us at the beginning and kind of caught mid-session, my name is Dr. King. I'm the National Sales Director for the Biologics Division. We're hearing from Dr. Catterpall. She is a board-certified dermatologist from the Cleveland Clinic with multiple publications and experience with the use of PRP. Our next speaker is going to be Mr. Larry Helwig. He is actually from the Clear Skin Institute. Larry has an extensive background in the aesthetic space. He's been utilizing, the XOE product actually since from our launch date, and has had extensive experience within the within the XOE realm or exosome realm. Larry's background is he has a bachelor's of nursing from Arizona State University. He went on to specialize as a emergency medicine nurse practitioner for some time, but really for the last 25 years, he specialized in all phases of non-surgical aesthetic procedures. He's developed some of the most advanced methods in treating and training people that are known in the country. Back in the early 2000s, he started a system for a consultation program using technology to enhance rates and amounts captured within aesthetic practices. In the mid 2000s, he started what's called patient layering or techniques he's named called CT3, which stands for treated color, tone, texture, and tightening, which they focus on within each session. The protocol was later changed to Laser 360 and is actually utilized worldwide now. He's also on luminary board for many companies and speaks internationally as well. He's presented in Paris on his new technique for body consultations, as well as the psychology to enhance the lasting of treatments for the patients. He's developed certification programs accredited in the state of Arizona and Texas for laser didactics and hands-on training. In 2012, Larry developed Mastering the Business of Aesthetics, and this is to help med spas grow their business and using the business techniques that he's developed. In 2017, he actually built a game kind of changing event where he brings hundreds of people together for a day of personal growth. This is all about raising your standards and building the 7 pillars of profit to create exponential growth. Recently in 2020, he developed the ultimate training, pretty much the premier training center in the country there in Phoenix, Arizona, with the latest and greatest technologies. So for many years, Larry's been teaching his advanced consultation techniques to thousands of physicians, nurse practitioners, physician's assistants, and staff. This is to elevate everybody's closing rate, the dollar amount, and the overall patient experience. Larry is also kind of inundated with emails and texts from many people. So because of his phone constantly being inundated with texts and questions, he actually started a podcast, and that podcast is named "What Would Larry Do?" And this is to help answer those everyday questions. So he also is a luminary for us at Aesthetic Management Partners, and him and Dr. Ann Watwood actually lead our 2-day advanced training that all of our AMP customers go to after they've had our capital devices for a few months, and they go and learn all our advanced training techniques. So without further ado, I turn it over to you, Mr. Hellwig.
Thank you, Rob. I appreciate it. And what we're going to do is we're going to have a brief discussion on XOE and kind of look at what it does and how it does it and what's involved in it. So let's see here. I think we can go right. Here we go. All right. So XOE has really been developed over 20 years with an investment of about $10 million to get extracellular nanoparticle technology. And this is something that is the new. If you go to a trade show, we were just recently at the aesthetic show, and there was presentation after presentation on exosomes. So, there's getting to be a lot of passion with it. People are excited about it. And I think it's the new direction that everyone's going. And so who can find the best way of doing it? What we have in the XOE product is Dr. Newman. He led the entire research on this. He's the leader of it. He's out of Beverly Hills, California. He is a board certified dermatologist, fellowship trained cosmetic surgeon. And when you read through all the things that he's been involved in when it comes to this, it's impressive. He has spent 20 years of his life. That's how passionate he is. And so he has a lot of patents. He has written articles. He lectures all over the world on this sort of thing. And so his specialty is stem cell therapy, and he's very good at it. He has a whole team of people, and he has created a product that we've been fortunate enough to get to use for some time now. And we've done some studies with it, and we love the whole comprehensive approach that we're going to get to talk about tonight. So when you look at the development of XOE, again, it was his passion for discovering a safe, holistic. He wanted this to be natural. He wanted it to be holistic, and he wanted a new approach to controlling cell signaling to stimulate rejuvenation. And when you think about that, that can be used in a lot of different ways. But to just take that and to say, okay, what did that develop? What did that get us? Well, of course, we have a complete organic stem cell system. It came from stem cells. It contains everything that you need. We have secretory factors, we have growth factors, including everything that's coming from the stem cell. We have small molecules, and this little is probably the wrong word for this, but his approach to putting this together has been so powerful that you'll see in the before and afters, and you'll see what it does, but how it affects the treatment, before the treatment itself, and then post-treatment. And I think that's really the key to it. The product, it does not need to be frozen. It does not need to be refrigerated. And it's used with light-based without any problem at all. And we use it with resurfacing, and we do a lot of it. And it's readily absorbed into the dermis. And so the thing is, you're not injecting, you're not doing anything like that. You're simply applying it to the tissue and giving it about 10 to 15 minutes to completely absorb. And so this is part of the whole system, and it's very important. So what he found in his research and his study is that the stem cells produce factors similar to human factors. So everything is very, very similar. And so that you have the human cytokine effect, and what it's doing is allowing for the same kind of results that you got with human exosomes. So doing plant versus human results were almost identical. So I wanted to bring this up. This here is obviously a plant, and we get asked at every training course, what plant is it and what is it? I'm going to tell you this is not the plant, but I want you to understand that it is coming from a plant, and this is it. And so, we're looking around all the time to find the plant. And here I am looking at a plant that has been covered up, of course. And is this the plant? Who knows? I doubt it. I think it's probably, these things are in a big vault someplace. But the idea of being able to take plant-based is huge. And when you look over what's on the screen right here, organic, gluten-free, it's water-based, vegan, paraben-free, sulfate-free, all of this, it's not tested on animals, water-based. But the key thing here, produced in FDA registered and GMP certified facility in the United States. And so you have a product that is extremely safe, extremely natural, extremely clean and pure that you're using all the time. And we love it. We love the process with it. And we love what it's doing for our patients and what it's doing for our practice. At the end of the day, you're either doing well with your practice or you're trying to do well with it. And what you add to what you're doing can make all the difference in the world. So we'll discuss that a little bit more. So XOE, what do we have here? It's a game changer. And I think people use that terminology loosely nowadays. Oh, this is a game changer. That's a game changer. But if you take a patient and you're looking at wanting to really help them, you want to improve their overall appearance. What are you going to do? We do know that a lot of times some of the more aggressive things we do get a bigger reaction or maybe a bigger outcome, or you can take a process of doing something more frequently and not quite as aggressive. But in any case, are there any patients out there that love pain or swelling or downtime? None of that. They want the wound healed. They want to get back to their life. And so if it's taking you longer, if the process is slower, if there's a longer recovery time, if there's more pain, if there's more redness and swelling, whatever, downtime, that hurts your ability to do what you do. And that affects your bottom line. And so when you're looking at the dollars and cents of something, if this were the only, and it's not, we're going to come back to this. If this were the only thing that it helped correct, all by itself, that's huge. To eliminate what you're seeing here on the screen, to make it more acceptable, to take days off of a healing time and a process that people go through. So it just changes everything. So you are shifting the healing cascade away from inflammation directly to rejuvenation. And that can't be overemphasized. And I think that those of you out there doing resurfacing or doing different procedures where it tends to be a little bit longer downtime, but this is a game changer. And that's why I say game changer is true when it changes things for your patient to such a degree that they go out and tell other patients about the success they're having with your procedure. And I think this allows that to happen. So it's very beneficial. So when you're looking at human dermal microvascular endothelial cells, okay, so they take these and you're looking at the scenario where there is no inflammation. You see a little bit of redness in the cell, in the nucleus. You see some of that, but not very much. Now look at the induced inflammation. It is red everywhere. And so you start looking at that. That's the inflammation. And what have we done for years? We do a treatment, and what do I tell the patient even prior to the treatment? Now, with the treatment, you're going to get red, you are going to swell, and hopefully you actually look worse. And, no one wants to hear that, but I tell them that up front, because that means that I did a good treatment, right? So that's what I have been selling for a long time. Instead of calling me at 10 or 11 o'clock at night that you're red, you're swollen, you're uncomfortable. If you're red, swollen, uncomfortable, throw a party for yourself, right? So, because that means you got a good treatment. Well, that's old. That's old. We don't have to have that anymore. If you look at the anti-inflammatory effects, there is still a little bit of inflammation, but nothing like what you see on the second little slide there, the induced inflammation, nothing like that at all. And so it's all the difference in the world when you can get rid of the inflammation. So if you take this patient that we treated here, and this is fractional resurfacing, about 150 microns deep at 22%. And you'll see her picture again later. We're going to come back to it. But if you look at the side treated, which is her left side, versus the side not treated, the right side. Okay, so is there still a little inflammation on the left side? Yes, but very minimal. Now, this is a patient that can take a shower, get cleaned up, and if her entire face appeared as the left side, she would be able to go out and have almost no one notice. And that is less than 24 hours after a resurfacing treatment for acne scars. So again, that's a huge change from the right side, where she could have that swelling for another 2-3 days, and not be able to go out. And in some cases, it lasts longer for some patients. And so if you can, again, going back one slide and going back and get it to the anti-inflammatory, where you have anywhere from maybe 80-90% reduction, which is about what we're seeing here. You put her back in the ballgame right away. It changes everything. Is that patient going to be willing to do that procedure again? Yes. In essence, she had little to no downtime at all. She could go out, be okay with it. Worst case scenario, she gives it another day and starts the healing process using our post-treatment protocol, which we will get to. So this is a game changer for that patient, which makes it a game changer for us. So anytime you can do that and you can help a patient and you can get them back in their lifestyle quickly, and while at the same time, having done a treatment that is going to change them for the better for the rest of their life, you are rewarding that patient in such a great way. And I think that's what we do for a living, isn't it? That's what we should be looking at. What can we do to help someone and make a difference in their life? And how can we do it to the best of our ability? And I think that's where XOE has come in for us. So we have the stimulatory effects, and XOE increases collagen and elastin expression, secretion of hyaluronic acid, all the things that we're looking for. So what you now need to think about is you just did some treatment on a patient, whatever it was. It could have been scarlet, it could have been laser, it could have been whatever it is. And with that, you're going to get more collagen, you're going to get more elastin. Well, at the end of that treatment, you took 60 seconds of your time to apply the XOE product. And by doing that, you've made the patient's life much better because of everything we just talked about. But what else? You just increased the expression of collagen by 28%. You just increased the expression of elastin production by 33%. And you've added 10% increase in hyaluronic acid secretion. So, this is like having done a whole nother treatment, right? So you did your original treatment that's going to get the patient this. Now, in 60 seconds, you just did a second treatment that's going to get them what you're seeing on the screen right there. Why wouldn't you do that? That has helped us in such a big way, and you're going to see that improves as we go into post-treatment protocol. But this is all good stuff. Why not? It is beneficial in multiple ways for the patient. So now, what do we need? We need the vascular endothelial growth factor. We know how important that is. It helps clean things up. You get cell proliferation, you get cell survival factor, you get all of that as part of it. And we've known that. That's all good, and that gets stimulated. So you get more of that. The cytokinins stimulate the transcription of VEGF. It does it. It increases it. And what does that really do? Look at the bottom. New blood vessels, response to oxidative stress. You get an increase in vascular permeability. Anytime you get angiogenesis, you get improvement. And you see that everywhere. Where those of you who've done treatments, vaginal treatments, you've done treatments for erectile dysfunction, you've done anything where you have increased the blood flow, what do you find? What's the patient come back and tell you? Things get better. It always gets better. And that's what this is doing. So you're automatically getting that as part of it. So that's very helpful. So what you're seeing here in the top screen is your control, and then you see the VEGF. Down below in the C screen is XOE, and this is 3 days. This is all a 3-day program on dermal endovascular endothelial cells. So this is what you're looking at. So when you see all of that going on in the XOE, that is dramatic. And Dr. King can probably discuss this further with you as far as exosome competitor. But I think what we're seeing is if you can get more blood flow, things get better, it heals faster. And, the discussion that the fabulous discussion we just had on hair. Well, Part of it is increasing blood flow, and that's why people will use red light caps and LED and things like that. Why? Increases blood flow. So we know how beneficial it is. You're automatically getting that. So again, big help. So here's our patient, and she started out with acne scars. This was her third treatment, and it's a dramatic improvement from where she came from. But again, right side inflammation, left side, almost none. And this is the next morning. So this is treatment was done in the afternoon. She goes home, we put the XOE on, she goes home, gets up the next morning, takes a photo. Boom, this is it. And so this is what she looked like. And different people are going to have, some people tend to swell a little more, have a little bit bigger inflammatory response, whatever. But this has obviously blocked, 80, 90% of it, probably about 90% for her. Now this next slide, this is Dr. Ann Watwood. I don't know if you can see the whole photo of her treatment side, but so on the right side, there is the swelling. And this is from Moxie. So this is a different treatment, not as aggressive. It's a level 2 Moxie. And yet this is the kind of swelling she had. So would she feel comfortable with the right side going out and to a party or going out socializing? Maybe not. But the left side, which I don't know if you have a clear view, dramatically better.
We can see it well, Larry.
Okay. Yeah, dramatically improved. So it really makes quite a difference. And then, of course, you start the post-treatment protocol. So that's what we're excited about, because you can take treatments that are not as aggressive as resurfacing. Now, we're known to do a lot of deep resurfacing here. And where we just tell them that, yes, you're going to look horrible, kind of a bloody stump for about 7 to 10 days, that type of thing. And we don't have our photos on that yet, but we will have photos for you. And a dramatic change in how fast people heal. Now, our patients all get LED red light therapy every other day with deep resurfacing. Why? Increased blood flow. So again, all we're doing all the time is what can we do to enhance not only the treatment and the results, but reduce your downtime, reduce what you're going through, so you're back in your normal social program as fast as possible. So when you do that, people appreciate it. All right. So it is a comprehensive, and that's how I refer to it. It's a complete treatment protocol. You can pair it with just about any aesthetic treatment you do, because if you elevate the experience to elevate the outcome, they're going to be very, very happy. And what I do, and this has worked well for me, I take and actually get the pre that we're about to go through, what the pre-treatment is. And then I have the XOE itself that we're going to put on at the time of the treatment, and then the post. And so when I'm doing my consultation, I want that patient to understand that we do more than what many other offices do. We have a complete program for you. Now, we've used other products where we had them for 2 weeks before and 2 weeks after. Well, this is 1 week, basically 5 days before and 5 days after, but it's 21 applications, not one. So, if we do the math on that, who wins? If you can apply a product that helps you heal faster and get a better outcome, and you can do that 21 times, as opposed to once, I think that's a pretty big deal. And that's what the patients understand. And now we have patients that are coming in who have had this, or who have their friends have had it and they were referred. And they said, now with the treatment that I'm getting, will I be getting that before and after and everything that my friend had? And the answer, of course, is yes. You want them to understand it is complete, it is comprehensive, and it's going to get them so much more. So when you look at the 5-day at-home pre-treatment purification and the whole program, what is that? They call it detox, a detox serum twice a day. And all that you're doing is getting rid of the garbage, right? That's what it's doing. It's helping clean it up. It's detoxifying everything. And so many people are already doing things to the skin prior to bigger procedures. They prep the skin, and that's what we're doing with this, but it does it for you. Everything is being done for you without doing another treatment. This product is simply put on morning and night for 5 days prior to the treatment. So what happens with it? Well, you get 10 times the stimulation of HA. As you all know, at age 30, the production of hyaluronic acid is drastically reduced. And for many people, it's almost non-existent. So our peak is really age 15. At age 16, things start to slow down and we get less and less. And by age 30, for many people, it's over. You know, there's about 14 different things, including fibroblasts and collagen and elastin and HA and NMF and all these things that isn't at the level it used to be. And in many cases, it's almost stopped completely. And so as we age, we start to see it. We get a little older, we're starting to see what's happened. We don't have that anymore. We don't have that benefit. So hydration of skin prior to receiving aesthetic treatments have been very, very good. And you're just simply prepping the skin to yield better results. All right. So when you look at in-office paired with any procedure, what are you getting? You can do RF microneedling, laser, IPL, you can do peels, threads, neurotoxins, all of these things. And, you know, most aesthetic facilities do a lot of this. And so it's working in synergy with what you're doing. It's going to enhance the overall experience for the patient. And you simply apply, you're going to do the before program, then you simply apply it. And in some cases, we actually apply it before the treatment, like with deep resurfacing. We'll actually apply it first, leave it on, let it completely absorb for 10 to 15 minutes, put numbing cream on, and before we do nerve blocks and all that sort of thing. So we will do it that way. But the key is you get blockage of 90% of the inflammatory response. I mean, you are still getting the benefit because of the cytokinins and everything else. You're still getting all of that benefit, but you don't get that overall look. So you have, thousands of factors that are helping you and helping the patient all the time. And of course, you're getting the stimulation, the simultaneous stimulation of collagen, elastin, and HA as you did the treatment. So your treatment is going to do some of that and hopefully a lot of that, and you are now adding to it. And you can receive up to 3 times faster recovery. So, even if it's twice, that's huge for patients, but in many cases, 3 times. And a lot of our treatments like profractional, we would tell patients, yes, just plan on roughly 5 days. But we don't do that anymore. 1 to 2, 1 to 2, that's it. Big difference. So again, I think it's such benefit for the patient, but again, we're also doing a whole nother treatment to help them. The repair is the post. Again, morning and night for 5 days, continued, blockade of inflammatory mediators, it just helps with comfort, healing, and everything else. 10 times the stimulation, increased circulation of soft tissue. So why not? And our recommendation is you just build it into the program. So we've talked about these benefits. You can look this over. And I think the big thing is you're separating yourself again from a lot of other offices. You're including something that many offices don't include. And so if the patient heals faster, gets more out of it, they are going to tell their friends. I think most offices would like to have a goal of being a referral only practice and getting a lot of referrals. What can you do to aid yourself in becoming a referral practice? Well, this is certainly going to do that. You can do fairly aggressive treatments with little to no downtime. That's a big deal. So again, all of this helps with all of that, and you're getting your results faster. So win-win situation. All right. So what we say is just build it into your treatment price and include it with every treatment. Patients will recognize it to be comprehensive, especially in the consultation. Take the time to show that you're doing what others don't do. This is part of your treatment. And you get this because it's going to do this for you. It's going to reduce your downtime, reduce redness, swelling, pain, all of that stuff. And in addition to that, you get extra collagen, you get extra elastin, you get extra HA, and many other things. So great outcomes with less downtime, create very, very happy patients that refer others to your practice. So elevate the experience, elevate the outcome, and I think that's it. So Rob, if you want to take over.
All right, thank you, Larry. We appreciate that. Before we jump into the Q&A, I did want to bring up Dr. Ketapal has a program coming up with one of our partner programs, which is Revive Advanced Training Institute. They are doing a live virtual with her for PRP hair restoration and facial rejuvenation. And so if you're interested in learning more about PRP application, obviously this would be an incredible resource for you to utilize. It's coming up, I believe, on August 20th, and they do live treatments with patients and have a Q&A session as well. Am I correct, Dr. Ketapal?
Yes, and just one, it says Columbus here. It's actually at my practice in Cleveland. So, we do everything from like male and female treatments, some PRP like tear trough injections. We treat acne scars, surgical scars, striae. And then there's also like a more involved didactic where we kind of go over the consent protocols, injection technique, and all of that. Thank you.
Perfect. Absolutely. And currently, if you are on the webinar and you're not one of our PRP customers yet, the Cellenis PRP, but you're going to be joining us as a customer, this is actually a value add that you get by becoming a partner of ours. And so typically this is about $1,000 value for this course, which for our new customers coming on, we're actually including this as part of your onboarding training. So it's an incredible value and just another reason, and really another thing that we believe here at Aesthetic Management Partners, that training is one of the most important things that we can do to offer our clients in order for them to really offer the most advanced procedures, techniques, and protocols to their practice and their patients. So, I do want to open the next slide here. If anybody has or is looking to have any more information for us on PRP or XOE, this is a QR code that you can definitely scan, and that call to action will actually get you. We have some pre-launch promotional pricing going on for both the Cellenis and the XOE, and this helps us get this information and get you in touch with either your local rep or the local sales manager. And if you're interested in bundling XOE and Cellenis PRP together, we have an incredible promo in place for that. You can scan the QR code to actually open that up and have that opportunity available for you guys for attending. Let me check if there's some more questions here. If we have anything unanswered, I believe Dr. Ketapal answered some questions as we went through. Does anybody else, I'll kind of wait here another minute. If there's any more questions about the XOE product or about PRP, go ahead and hit the raise your hand button or throw a question on here, and we can leave it open for another minute or so.
Is everyone able to see the questions that were answered? Because I think some of them were good. I don't know. I might just kind of go over quickly some of the questions people asked in my response.
I think that'd be appropriate. Yes, thank you.
Right. The first was about if microneedling with PRP should be done. And basically, if you're injecting PRP in the scalp, there's really no need to do microneedling with it. With that said, if you want to do microneedling with minoxidil or something else, you can combine that with the PRP injection, but injecting it will get it deeper. Someone asked what devices can you measure hair growth that other than global pictures. There's specific devices like the folliscope or the trichoscope where you could take a magnified image of the hair, and then they get read actually by a trichologist who does those specific measurements. Someone else asked if someone gets PRP for hair, should they stop using minoxidil? Ultimately PRP is just adjunctive treatment to your medical therapy. So everything works together synergistically. If they're doing well in a medical regimen, I would have them continue it if they're not bothered by it. And then the last one was how many treatments are recommended. Just to reiterate the protocol, it was monthly sessions for 3 to 4 months, then quarterly for the first year, and then yearly maintenance after that. And that was just for AGA.
Perfect. And then there's some questions on here for the XOE portion, which I'll address some of these. There's a question about XOE and hair restoration. I'm guessing if you're asking, can XOE be utilized with hair restoration, or is there some benefit for it? There's kind of two parts to that question, honestly. XOE will help within the overall dermal health and all things. The XOE formulation is actually formulated specifically for skin restoration, and the anti-inflammatory portion can definitely help with the hair restoration, because and Dr. Ketterball, tell me if I'm wrong, all hair loss is really, the first part of it is really an inflammatory portion. We definitely have other reasons, hormonal imbalance, but even androgenic alopecia has an inflammatory portion to it. So XOE can definitely help with the anti-inflammation portion of it. We actually do have a product coming to market called XO Grow. Give you a little bit of a look behind the curtain. That's going to be launching here in a couple of months. XOGrow is actually specifically formulated for hair restoration, and it will be a topical product, plant-based exosome-based product as well. We actually have some pilot trials going on right now, but essentially, if you want to use XOE paired with hair restoration, it would go very well, especially if you're injecting PRP. XOE would be good to put on beforehand, because of that acute anti-inflammatory response that you get out of it is actually going to make those injections less painful. Because if you can block inflammation at a cellular level like we can with XOE, we actually block the transcription of the pro-inflammatory factors. Then you don't sensitize the nerves as much. And so we actually get reports that pretty aggressive procedures, whether it's resurfacing, or even things like microneedling or even injections, are actually much more tolerable with XOE in place already. So there is a place for it, but further down the road, just a couple months here, we do have an exosome product for hair restoration specifically as well. Larry, this would be a good question for you. How much should you charge to add the XOE? And this is a pretty common question we get asked a lot.
Well, I would say $300 if you're going to charge, but we don't. We raise the price of the procedure and build it in so that patients don't feel like they're getting nickel-dimed. It's like, okay, I got to buy this. Now I got to buy this. Now I got to buy this. Just charge what you need to charge for the overall procedure and then include it. But if you did want to do it as a one-off, or you want to sell that separately, I would think $300 would be very reasonable, and that's what we used to do before we got smart. It's better to just include it.
Yeah, I can speak. A lot of the other practices that I've implemented are doing exactly what Clear Skin is doing. Initially, they did it as an add-on, but then they found it was so much more benefit that they decided to just increase the price of RF microneedling by, a value of, a markup from the product of, at least 200 or 300%, because you're basically giving them another treatment, as we talked about the increase in collagen and elastin, hyaluronic acid production. And by the way, those studies were done on a single application into the cell medium, and looking at the expression and the gene turnover of HA and collagen elastin production. Remember, the entire system of XOE is actually 21 applications, because you get 5 days of twice daily before, then you get the day of, which is the XOE, then you get the repair portion, which is again another 5 days of twice daily. So there's 21 actually applications. So you're hitting that rejuvenation cycle multiple times. So you get really good stimulation. Another question for Larry says, what does Larry find is the most noticeable or immediate benefit for patients with XOE and injectable treatments or things that are breaking the surface of the skin, even like RF microneedling or ablative procedures? Like what are your most noticeable things on those more aggressive procedures?
Well, I think, again, I think there's a little less sensation for some reason. They do well, they do better with it. So that's probably the big thing. I think longevity of treatments always do better. Resurfacing and what have you, we do a lot of that. And we find that by applying it prior to applying the numbing cream, that it works really well, in our more aggressive treatments. But I think with injectables, applying it before is going to help with the overall sensation and experience. It's not bad. And I think exosomes has changed our practice so that we're trying more and more things all the time. You're going to experiment. You're going to try it with this and try it with that. And the patient says, that's better than it's ever been before. All of a sudden, well, all right, let's keep trying it. And that's what we have done. And we've added it to not just microneedling, RF and Agnes, that we always use it with that. That's just standard. Now, we don't apply it prior to Agnes or Scarlet. And the reason is because we're trying to anchor the tissue. We want to lift it. We want to pull it. And we find it too slippery if we're trying to do that. So we do it after. But the results have been fantastic and patients love it. So I think there's lots of places you can use this, and it's going to make a big difference for them. And on our Agnes patients, really big difference in the overall, again, swelling and inflammatory response. So if you're doing Agnes and you're not doing this, do your patients a favor. Bring this on board and start using it. They're going to love you for it.
Perfect. That was actually one of our next questions that you answered, was with Agnes microneedling and the other microneedling with Scarlet. They're asking if you apply before or after, which you answered. You're doing it after because you're doing the lifting and anchoring, and it's too slick then if you're doing it before, is what you're saying.
One of the advantages with Scarlet, and Dr. Knob was quite brilliant in all this. A lot of the treatments being done out there nationwide are being done just strictly for tightening or contraction. And when your collagen bundle unravels and it becomes cross-linked and unravels over time, if you can contract that, it's collagen reformation and doing that sort of thing. But I think by adding this to what we're doing, we're able to see more. The patient's getting more, but we're really getting to focus on lifting the tissue, not just tightening, but lifting. So when you get your 55, 60, 65-year-old patient and they really want this up and elevated, well, there's things, there's thread lifts and there's this and there's that. But if you're doing Scarlet, why not do it to the best it can be done and really put lift into the protocol and then add exosomes to give you all the extra second treatment, if you will. That makes a big difference.
Thank you.
Yeah.
Another question asking about the application of XOE was, so you're pre-treating with the XOE first before you place the numbing cream on, or are you doing it after the numbing cream?
Only for deep resurfacing.
Okay.
So with deep resurfacing, because when we're done, quite honestly, we've taken the entire epidermis off. We've taken part of the dermis off. It's a mess. So what we're trying to do is do it in advance, and it seems like you get the same benefit. And then the next morning, they will go ahead and start with the repair. So it's worked great.
Perfect.
Yeah. Okay, as it says, do you keep it frozen like the others? And no, you don't need to do that. You don't need to refrigerate it. You don't need to freeze it. It's just shelf. It's on the shelf. It's room temperature. And this is, again, it's been made so easy to take and apply that to the tissue. You're adding a 60-second procedure to your procedure. And what do you get in that 60 seconds? You get faster healing, less inflammation dramatically, maybe up to 90% less inflammation. You get much, much happier patients. And then not counting the benefits of the extra collagen and elastin and HA, all the good things with it. Why wouldn't you do that? This is, we're doing procedures now that are $1,000, $1,500, $2,000, $2,500, $3,000, up to $6,000. Adding this in is nothing. You just build it into it. I've never had a patient leave me over $150 or $200 or $250 on a $1,000, $1,200, $1,500 procedure. Nobody leaves, and so what you're doing is you're enhancing the entire experience for them, and you're giving them so much more. Make it part of your program.
Perfect. Well, I think it looks like we've answered everybody's questions so far.
Okay.
If anybody has any further questions, you can obviously reach out to your local reps. And if you need to get into contact with Dr. Ketterpaul or Larry, we can actually arrange for them. They're more than happy to speak with you on one-on-one basis as well. We try to schedule that so we don't overwhelm their time by any means. And I'm also available for questioning on a regular basis on either product as well. I thank you so much for everybody joining us tonight and taking the time this evening to join us and learn about Cellenis PRP and the XOE product as well. This has been incredibly informative. I want to thank, the giants we have among us with Dr. Ketterpaul and Mr. Larry Hellwig. You guys are experts in your field and you're experts tonight. And we really appreciate the info you gave everybody. And I just want to thank everybody for joining us and we look forward to doing this again soon. Thank you.